Hello and good evening. I'm Melisa Idris.
And I'm Sharaad Kuttan.
Welcome to Consider This. This is the show where we want you to consider and then reconsider what you know of the news of the day. All folks' homes house some of the most vulnerable in this pandemic, and yet we've heard concerns raised over apparent gaps in the inoculation process for the elderly, especially those in nursing homes. Have residents and staff of care centres for the elderly been neglected in the national COVID-19 vaccine rollout? And do COVID-19 SOPs take into account the vulnerabilities of this particular demographic? Now, everything from testing to quarantine procedures to tech-centric registration and notifications. Tonight, we're going to explore all of this. Let's speak first to Fong, the National Secretary for the Association of Residential Aged Care Operators of Malaysia, which is an association representing some 200 old folks' homes nationwide. Muntoh, good evening. Thank you so much for joining us on the show tonight. According to your association's president, Delron Douglas, there's currently only 12 government-run old folks' homes in the country and another 365 licensed private ones. But what's also staggering is the significant number of unlicensed nursing facilities for the elderly, about 1,300. Now, if you could begin our conversation by helping us better understand the differences between the licensed and unlicensed old folks' homes in terms of, size, in terms of staffing, and the medical care and attention that they receive.
Okay. Good evening, Melisa and Sharaad. Okay, thank you for inviting me here. To understand the spectrum of aged care is this. Number one, they are basically registered under an act called the Care Centre Act, which is under Akta 506. So, which is under the purview of Jabatan Kebajikan Malaysia. So it doesn't matter which home you go into now. So even if it's a very nice 5-star looking home, they are registered under Jabatan Kebajikan. But in this registration, there is a wide spectrum from charity organization to all the way to pure 100% top of the range premier assisted living center. Now, there's another act which is called the Private Healthcare Facilities Act, Akta 586, the 586 Act, which actually covered private hospitals and private nursing homes. Now, actually, the word nursing homes denote it is a hospital-based kind of environment, and is registered under 586. But in Malaysia, we generally give a very broad spectrum. We just call it old folks home, nursing home, all kind of homes, depending on the outlook and what is on the signboard. Okay, so generally, all homes in Malaysia, with the 1,700, with the exception of about 22, all of them are under the Jabatan Kebajikan, the Care Centre Act. And now that is the spectrum that we are talking about.
Right. Now, thanks for giving us a really clear idea of what the landscape, and it's quite diverse, as you suggest. Could you help us, if you go back a year when the pandemic was beginning and, we had that first lockdown, did your association, did people running these homes, whichever level, start to sort of think about the problems? Because we already knew from Europe, many of the deaths that were occurring in Europe happened in residential homes for the elderly and for the geriatric sick. So was there a conversation here about what needed to be done in order to prevent a repeat of what we saw happening in Europe?
Okay. When the thing start, when the MCO was coming last year, KKM or the Ministry of Health, they were actually pretty efficient and pretty good. I mean, under the leadership of Noor Hisham and the DG. So we actually locked down the entire centers. So full lockdown means no visitors. We follow a very strict SOP. We wear gloves, we wear masks all the time, and we also stop all visitors. And we actually, for those single staff, even some of the married staff, we stop them from going home. We lock them in the center for 3 months, actually, to stay there, work there, because it was the first time the MCO 1.0 we actually took a very drastic measure, which explained the low death rate in Malaysia. In fact, until today, only about 40 plus homes has been infected. Okay, and my own center was infected in a small way, but we was infected. But the death rate was very low. I think based on what I understand was about less than 40 death from the nursing homes. So, well, I think that is a pretty good control and compliance by the operator and a very good SOP from Ministry of Health.
Okay, but still, Muntoh, let's talk about the vaccination program. Have nursing homes, and including the 1,300 unlicensed nursing homes, have those nursing homes been taken into consideration as part of the national vaccine rollout?
Okay, you are just the right time, because today we had a meeting with Khairi Jamaluddin, and this is the conclusion for the whole thing. Now, number one. Now, one thing for sure, we have always been in contact with Ministry of Health. Old folks home or nursing homes, they have not been neglected. Now, the issue started was because there was a lack of communication for whatever reason. So the elderly centers felt they were being neglected. For about 2 months, there was nothing happened. No news, even calls was not responded, WhatsApp was not responded, email was not responded. So that is when the frustration and the blowout happened now. Having said that, I will start on the nursing home. The KKM actually started vaccination even yesterday. So in Penang, within 2 weeks, all the nursing homes will be those in the list will be vaccinated. So they are taking action. So they're moving very fast. Sabah, Sarawak, they're moving already. Perak, Kelantan, they are moving already. Putrajaya, Dan, Ipoh, they are moving. So these 2 days, we saw a lot of activities, and in fact, tomorrow, Kepong, the Kepong site will be starting as well, and KL as well. So there were a lot of activities.
Muntoh, right. So that seems to be really good news. But is it a bit late? I wonder if we can do why it took such a long time, considering when you think about the nature of the problem. These are old folks, people who are actually very vulnerable and in a residential situation, meaning they're actually very easy to get to. Once you identify a place, you can go there and you can vaccinate everybody, including the staff, right? So it would have been a very easy thing to do, like, vaccinating people in prisons, another, often a policy blind spot. Now, why the lag?
I don't know what's the reason they have, but definitely there was a lag and in fact, a blackout of information for about 2 months for us. So I don't know what's the reason, but from these 2 days, we know it can be done very fast. So to answer your question, Sharaad, I don't know why they had lagged, and I don't want to speculate because I'm not working in KKM. I know they work hard, but what was missing, I really don't know. But we know in 2 days, so many states are moving. So
okay.
I have to ask you.
I'm glad there's some action being taken. Sometimes the public pressure is what's needed. Often, when things get neglected or there's been a blind spot. And I wanted to ask you about how that process is being done. Given that the elderly are in homes, are in care centers, are the vaccines being brought to them, or are they having to be brought to the vaccination centers?
Okay, YB Khairi made it very clear. The vaccine will be brought into the center. Now, once they will be giving us AstraZeneca, AZ, and they will come in over to do the doses for all the centers. So the process now is the district have actually contacted all the homes in the district, and they will set a time and date and go in and we just do the vaccination. So morning probably one center, afternoon one center. And then they will move on. In fact, they will do it for all the staff. And in fact, Khairi Jamaluddin was saying that registered home or non-registered home will be covered. Okay, and he will make an announcement to bring out all the non-registered home and start. Look, saving life is important. Don't worry about your status now. We are prepared to have a bit of things. He used the word kelonggaran for this pandemic period. And he also made a statement saying that even foreign workers, okay, working in homes will be vaccinated. So they will vaccinate the residents, the staff, local and foreign, and even the non-registered home. He wants them to come out. So that is the duty of Age Corp. We also want to bring them out into the light because they are hiding.
Muntoh, this is very interesting. The pragmatism that you're saying that's being led. I mean, Kari Jamaluddin, of course, with Mosti, they're taking a very pragmatic view of the problem and trying to, be a problem solver. That's great. I do want to ask you about this. When we get over this pandemic, what needs to be done? Clearly, there is a need for these homes. The ecosystem is there, but it's not regulated enough. What can be done to build back better our care facilities and their regulation?
Well, we are basically going to solve a 60-year-old problem. Now, due to the years of needs of care, so there were a lot of kelonggaran has been given by the ministry because of the needs of the people to take care of the elderly, because there are not many centers out there in the early days. And of course, now with the awareness, there are more coming up as well. So what do we need to do is, of course, there's the new act coming out, Akta 802, which is a guideline called the Private Agent Healthcare Facilities. So this is where our association, Age Corp, is working with the Bahagian Amalan in KKM, with the head there, to formulate the guidelines to manage the centers, so that everybody will come in line, and they will be given a few years to fall in line. Now, we will foresee this guideline is useful, but there will be a lot of challenges ahead, because it's a new guideline, and a lot of nursing homes, we have to bring them out into the light, because now they are not in the light. So this will be a long journey.
Can you just help me understand whether I've got the figures correct? Are there only 12 government-run old folks' homes at the moment nationwide? Versus 365 licensed private ones?
Correct. The 365, you can get it from the Jabatan Kebajikan website. Now, the 12 homes are called Rumah Sri Kenangan, okay? And
why the asymmetry? Why is there such a difference between the publicly run old folks' homes versus private?
I think it's also the cost of doing it, and it's a big problem. Okay, the problem is so huge. There is no amount of public homes that the government is building is enough to solve the problem. So basically, based on the 12 centers, they can only take in about 4,000 people out of the country, big amount of elderly.
Right.
So
so
we don't.
Well, Muntoh, I think we've touched on an entirely bigger issue that we might have to have you back on to discuss on another show. But thank you so much for shedding some light on this issue, and good luck with the action for vaccination that we're going to be seeing hopefully soon for nursing homes. Thank you for your time tonight.
Thank you, Melisa. Thank you, Sharaad. And
we're going to take a quick break here on Consider This, but more on this topic in just a couple of minutes. So stay tuned. We'll be right back.
Kita boleh maju. Induknya adalah Melayu.
Balik kepada Islam. This is orang yang membuat polisi.
Kalau itu yang dikehendaki, fine. Mungkin kita berbeza pandangan.
Tapi kita mempunyai kuasa yang boleh menentukan budaya di masa hadapan.
Polisi yang mesra wanita, sudah tentu dia akan datang daripada pemimpin wanita.
Perang COVID-19 masih belum berakhir. Dalam kita berusaha memutuskan rantaian wabak ini, kita jangan terpedaya dengan virus maklumat palsu. Simak fakta melalui www.astroawani.com atau aplikasi Astro Awani. Teruskan berdisiplin, ratakan lengkungan pandemik ini.
The third wave of COVID-19 has taken us by storm. There's no room to take anything lightly. Everyone must follow all the steps to stop the spread of COVID-19. Social distancing, face masks, follow these steps, this SOP with the utmost discipline. Together, we can flatten the curve.
Bila sentuh soal berita, tiada masa untuk tunggu. Kepada anda kami bawakan fakta, susulan dan kupasan yang terkini. Tiada drama dan tiada pengulangan. Usah tunggu lama-lama. AWANI 745 lebih awal dari biasa.
Kini berwajah baru.
Ini pula susulan khas pesawat Back Air di Kazakhstan. Pesawat berkenaan dilaporkan tergelincir 2 kali.
Notifikasi berita terkini dan navigasi mudah. Podcast dikemas kini dengan berita dan program.
Rebirth, Reformasi, Resistance and Hope. Thanks so much for staying with Sharaad and I on Consider This. Let's continue our discussion about whether the residents and staff of care centres for the elderly have been neglected in COVID-19 vaccine rollout nationwide. We speak now to Professor Dr. Tan Mopin. She is a consultant geriatrician at University Malaya Medical and Specialist Centre. Dr. Tan, good evening. Thank you so much for joining us on the show today. Now, I'm wondering whether you could begin with that broad question, whether you think the elderly population, particularly in care homes and their caretakers, have been a blind spot in the COVID-19 management pandemic. We've heard now that there's going to be some movement in this area, some urgency in vaccinating the elderly in care homes. But why the delay? Why the lag? What do you think?
Okay, there are several questions there. So blind spot-wise, internationally, I would agree that care homes, nursing homes have been a blind spot when it comes to management of COVID-19. But a lot of international countries, because of the really bad publicity that they had with all the mortality that was happening in their care homes, have actually made amends by actually prioritizing care home residents for vaccination. But that was after a really, really bad death toll. Now, for Malaysia, it's kind of become the other way around, because we actually did rather well when it came to protecting our older people in care homes in the first 2 waves. Even the third wave, we didn't do too badly. And so we didn't see many care home deaths, thank goodness. We managed to protect our care homes very well by actually mandating that all people discharged to care homes from hospitals were being swabbed, and our care homes were being locked down very early. But now, because of this relative success, we've almost become complacent, and we've been rather slow, in fact, a little bit painfully slow in vaccinating care home residents. And we're now in the middle of our second wave, and very few of our care home residents have been vaccinated. In fact, we've actually gone for community dwelling older people and touched very few of our care homes so far. So we really need to speed up this effort, because now we can see that there's a big wave coming and there's a lot of deaths, and I don't think that our care homes can hold up much longer.
Dr. Tan, could I ask you about this, the strategy that that was enacted with the vaccination program, which was to put older folk in phase 2, right? And that was, and they would have gotten either the Pfizer, the Sinovac vaccine, and then now they have this carve out with AstraZeneca. But now we're being told that the older folks are going to be recipients of AstraZeneca as as part of that. Now, what do you make of this, considering the policies that have been instituted in other countries around AstraZeneca and the risk attendant there?
Yes, I mean the policies have really surrounded Europe. They're not really very good they're not really a very good place to follow when it comes to vaccine policies, because they've really made a bit of a mess of it. So what really we should always stick to is the fact that there is a shortage of vaccines worldwide, And the vaccine that we have is the best vaccine. So whatever you're being offered, take it. And for older people, it's a special bonus because actually AstraZeneca is, for older people, they're going to get the most benefit with risk-benefit ratios. So the risk of them getting blood clots are far lower than that of younger people, but they will actually enjoy far greater benefits in terms of reduction in mortality or death and hospitalization. So really, AstraZeneca is the right choice because it's available.
Right. Dr. Tan, have you seen, a pickup in terms of vaccination sign-ups, in terms of the vaccination, the inoculation process itself? Have the elderly population in Malaysia been eager to get vaccinated?
Well, I think it's a bit mixed. There's definitely a clear group who wants the vaccine and wants it ASAP and understands the benefit of the vaccine. But from the feedback that I've been getting from my patients and also from what I've been reading in the press, it looks like there is actually the sign-up rate for our older people is actually lower than we would like it to be. Well, that might not necessarily really reflect entirely on vaccine hesitancy, because what it might be is that a lot of older people have difficulty signing up. But still, even when I see them in clinics, some of them are worried about vaccine safety. And the problem is that whatever information that we're sending out there are not getting to these older people. The information they are getting is primarily from all this scaremongering that's been happening. And so we really need to address the way we actually disseminate information because it's not really getting to a particular group of older people.
Dr. Tan, can we address the difference between older folk who live at home and with their families and those who are residents, who are institutionalized, and what you understand to be the landscape of older folk in these institutions, their capacity to both explain the risks, persuade residents to get this, or even their ability to make those kinds of choices? How do we understand what's actually happening in the care homes where older folk who are vulnerable are?
Yes, that's right. So about 1% of our Malaysian older population lives in care homes. So it's a very small number, but disproportionately about 7% of our hospital population actually come from care homes. It's because they tend to be frailer, and we see a lot of more people with memory problems, and a lot of most care home residents need some sort of help. Otherwise, they will not need to be in a care home. So generally, some of them make decisions, some of them need decisions made for them, but across the board, a majority of them will find it very difficult to go to a vaccine center to actually be vaccinated. Now, that's totally different story when it comes to older people in the community. And the message that's been sent out by our government is that they're labeling these people as dependents, and they're asking their adult children to actually register for them on the MySejahtera app as a dependent, because a lot of our older people are not savvy with using the MySejahtera app. So that is actually a very off-putting approach, because majority of our older people actually still make their own decisions, and they're mortified to be actually considered dependent because they don't really want to trouble their children. And really, they would rather not have the vaccine than having to be tagged under their own children's MySejahtera app. So the approach needs to be readdressed. Older people make their own decisions, and there needs to be ways where they sign up for themselves.
Well, can you elaborate a little bit on that, Dr. Tan? What would you like to see changed in the immediate term? What would you like to see improved? Particularly, I'm wondering whether the approach to vaccinating the elderly should be completely different to that of the general population.
We believe that whatever approach has been taken at the moment actually favors people who are very used to using the smartphone technology, and also potentially discriminates against other vulnerable groups such as the Orang Asli and also the rural areas. So when you change the tactics, it will benefit more than just older people. It will benefit people who are disabled and also the rural areas and other vulnerable groups. So we actually think that they should actually engage community leaders and non-governmental organizations to actually convince these older people that they need the vaccines, as well as help them to actually get registered. So we do have quite good community outreach groups that at the moment feel a little bit redundant because they're not being allowed to go out. They are told that they have to, obey the MCO, and they're not really engaged in any way. I know we don't want them to go out physically, but they are still able to actually contact older people through the very old-fashioned telephone that was invented over 100 years ago, and all older people actually have access to the telephone. Yeah, so those sort of technology can be engaged. Yes.
Yeah, there's also many other problems, and that's got to do with language, isn't it? I mean, if the MySejahtera app comes in English and Malay, there are many old people in older generations who do not speak or use that language or have a facility with that language. They might be speaking Chinese dialects, or they might be speaking Tamil, or they might be speaking Orang Aslian languages, or Dusun or Kadazan, whatever it is. How complex do we need? How do we deal with this complexity? No government is very difficult. They like one size fits all type of solutions. What would you suggest to them?
Well, engage community leaders, localize solutions, work with people who are used to working with these people, and they know how to get in touch with these people. Getting everyone to register first for the vaccine when actually, I know the Pfizer vaccine had to have a cold chain, but it didn't really need to be complicated to this extent. Nowadays we have vaccines that don't really need such ultra cold temperatures, and actually having vaccination centers that people can just drop into will actually really help. And we've had this kind of efforts before with other things. We can definitely do it for vaccines.
Will GPs help? Will engaging with very quickly, will the engagement of GPs help with trust and proximity to vaccines?
Yes, definitely, because a lot of older people do go to private GPs, and the efforts in engaging them has been rather slow for reasons that we are not clear with. And still, after GPs have been named as a potential vaccine deliverer, there's still this need to use the MySejahtera app to register and for the GPs to wait to be given the numbers to be called to come in for the vaccine. I think MySejahtera has its purposes, I agree, but there needs to be better ways of doing the vaccination than going through a particular smartphone app.
Right. Dr. Tan, thank you so much for joining us on the show tonight. We appreciate your time. Thank you. That's all we have for you on this episode of Consider This. But before we leave you, a quick reminder that you can get all the latest news and information on COVID-19 vaccines on astroawani.com as well as the Astro Awani app. Thank you so much for watching the show tonight. I'm Melisa Idris.
And I'm Sharaad Kuttan, signing off for the evening.
We will be back with you same time tomorrow. Till then, good night.
Ke depan kita dan maju. Induknya adalah Melayu.
Balik kepada Islam.